Steroid hormones, they can be easily measured in the blood, saliva, or urine. However, they're not always easily interpreted. For example, in a patient who's tested in more than one specimen type on the same day, at the same time even, we usually do see good alignment between different specimen types, but not always. Why is that? Well, it's a question we get from both new and experienced clinicians, and it's something I want to dive into here using this diagram from Genova's new endocrine support guide. Usually when I have this discussion, I start by talking about some of the differences in terms of how these hormones are transported into a given specimen type. So there are some nuances here. When we look at hormones in the blood, most of those hormones are bound to a carrier protein, sex hormone binding globulin, or albumin. That's unique to that specimen type. When we look at hormones in the saliva, those are unbound, but they do have to pass through the salivary glands and through the oral cavity. So unique to that specimen type. When we look at hormones in the urine, they have to be filtered through the kidneys. So there's something that is a variable unique to that specimen type. Adequate renal health is important if we're looking at anything in the urine, really. I look at quite a few results in patients who are on bioidentical hormone therapy, patients who are using a troche or a sublingual, so an oral form of hormone therapy, one that's placed in the mouth. There's potential for troche or sublingual therapies to end up in the saliva, and that could potentially lead to really high results. May not reflect systemic levels. You might be looking at direct deposit into the salivary if they're on those hormone therapies at the time of testing. For vaginally applied hormones, there is potential for some of that to end up in the urine stream if they're not applied very carefully. So could be a potential contaminant directly into the urine stream and also not reflective of systemic levels in some cases. So not all cases, but something to be aware of. For topical bioidentical hormone therapies, there are really some unique characteristics here in terms of the dynamics related to absorption, accumulation in adipose, transport, even metabolism. So it begs a lot of questions, especially in saliva. Not to say that it's not a valuable therapy. Adding on to that thought, we did come across one published study that hypothesized that there may be a small subset of people that have the ability to secrete an abundance of hormones in the saliva and called them high secretors of hormones. And that may also be something to think about when you're looking at a salivary test and you're seeing extremely high results. It's something to always take into account with the clinical presentation. Ultimately, the clinical question we want answered with any kind of hormone testing is, what are the levels like in the tissues? That's really kind of like the $1,000,000 question here in terms of thinking about our hormone therapies, thinking about our patients' hormone levels. What are the levels like at the tissues? That's really what we want to know. I find this diagram to be helpful for sort of engineering some of the answer to that question. So I wanted to share that with you here. I also wanted to mention that we've seen discussions around hormone specimen types almost become branded to some degree. And it's a little unfortunate because some of that dogma can overshadow some of the science behind each specimen type. They each have their benefits. They each have their limitations. So the answer is not that one specimen type is always best for every single patient. You can find this diagram on page 41 of Genova's Endocrine Support Guide, available on gdx.net. You can also find the sample report, which looks like this. This is for the EndoPlus profile. This allows you to test steroid hormones simultaneously in more than one specimen type. Lastly, if you would like to take a deeper dive into this topic, then the Unlocking Hormonal Health online course from Genova would be worth registering for. That's coming up soon, and it will be taught by Dr. Pam Smith, Dr. Christopher Moat, and Dr. Michael Chapman. Great speakers, great content. We hope you'll join us, and thanks for joining me today. Take care. Bye-bye.